Hello everyone. Once again, I wish to welcome you to our channel, Health Focus. My name is Wesley. Now, today I have a very hot topic to discuss, and this addresses people who practice anal sex. Now, in recent times, there's an increase in people who practice anal sex. There's an increase of homosexuals or the practice of homosexuality, and that practice is increasing in recent days, especially in Kenya. And we need to address some of this issue so that people make decisions from an informed position. So the discussion is going to be the problems you are likely to face if you practice anal sex. And I want to start from the word go by saying that this is not the discussion is not an ethical or a moral or a legal issue or discussion, but my focus is on the medical part. It's good to know the side effects of practicing anal sex so that when you get yourself into that, you are fully aware of the problems you're likely to face so that you can make a decision. Now, I want to state that the anal part is not well lubricated as the vaginal part, and ideally it was not meant for sex but for other things, and that's why we'll discuss something to do with the fecal or bowel incontinence, whereby you find that there will be leakage of the fecal matter if that system is interfered with, and the other problems you are likely to face. So I'm going to illustrate the anatomy of the anal region for your understanding, and I'm going to use a diagram for your understanding. Now, what you see there, this is the anal part. You can see here the rectum and the anal canal to the opening, which is the anus, and there are muscles here. We have the internal anal sphincter muscle. There's also the external anal sphincter muscle, and there's also the pupil rectalis or pupil rectalis muscle. These muscles, they work hand in hand. The contraction and the relaxation of this muscle, they ensure that the fecal matter is contained with this region. They control that fecal matter, and this place has nerves. Okay, in fact, the anal region is has a very many number of nerves, and these are important because they send an impulse, or when there's a stimulation, they send an impulse to the brain, so that when you want to defecate, the brain is able to interpret that information from the neurons here or the nerve here. It goes to the brain for interpretation back to the muscles so that they can either contract or relax. There are also ligaments that help all this system. So when you practice anal sex, the problem you're going to have is that you're going to damage these nerve cells here. You're going to damage the nerves here, and you also damage the muscles. Now, these muscles, they are not very elastic as compared to the other muscles in other places. So if this damage happens, and remember, this process of defecation and control of the fecal matter is controlled by the brain, then you're going to have leakage of the fecal matter without control. Okay, so if that happens, then you will be on diapers the rest of your life. So this is a caution for those people who practice anal sex, that the problem you're going to have is there will be leakage of the fecal matter because of the destruction of the nerves in this area, and also the muscles, which were not meant for actually sex. So you'll be on diapers the rest of your life if you practice this kind of anal sex. So these are precautionary measures that you need to take note so that you make a decision. And I should say, this is information. What you do with it, it's upon you. I wish you all the best. Thank you.